Hello, and thank you for scheduling your consultation for orthodontic treatment. The purpose of the consultation is to review the findings from the x-rays and photographs that we took at the records appointment and to discuss the treatment plan options that are available. So in this video, what I'm going to do is review some of the things that I'm looking for or looking at when I review the x-rays and photographs. Anytime I look at a case, I always look at three things. I look at how the teeth fit together, how the jaws fit together, and how any problems with one or the other may impact the patient's soft tissue. For example, you've probably seen someone in passing who looks like they have no chin. They go from nose to upper lip to neck. Well, that person probably has a skeletal discrepancy such that the lower jaw did not grow at the same pace as the upper jaw or the rest of the facial structures. And if that person were interested in orthodontic treatment, we'd have to take that into consideration because if the jaws are off to that significant degree, then the teeth are probably also off, and we're already aware that it's impacting the patient's soft tissue because it looks like they have no chin. Now that's an extreme case. Most people are somewhere in the middle. Maybe the jaws are off a little bit, but it's not affecting the teeth and it's not affecting the soft tissue. Or maybe the jaws are fine, but the teeth are out of position, and the position of the teeth is impacting the soft tissue. So in any case, the soft tissue becomes an indicator for what may be going on underneath and helps guide us to the most appropriate approaches. For that reason, the first few images that we'll look at are of the patient's face. So we're going to take a look at the patient's profile, and we're going to evaluate the curvature of the profile. We normally want to see a nice curvature as we go from the forehead down to the nose, back to the lips and chin. And if there are any deviations from that, then that may give us an indication of whether there's a skeletal discrepancy. Has the lower jaw outgrown the upper jaw? Has the upper jaw outgrown the upper jaw? Are the teeth in a position that's impacting the patient's lips? Next, we'll take a look at the face from a frontal perspective at rest, so no smile. In that image, basically the main thing we're looking for is to see is there any significant asymmetry in the facial structure from left to right. Just about everybody has some degree of asymmetry, so we're not looking for just a little something here or there. We're looking to see if there's something significant that would indicate some sort of structural asymmetry. And then the last image of the face that we'll take a look at will be of the patient's face on a frontal view while smiling. So we're going to look at, we're not going to be looking at any individual teeth. We're looking at how much tooth structure does the patient display, how much gum tissue does the patient display, and is there too much or too little of one or the other. The upper lip should fall right along the upper gum line. So I have a little bit of a gummy smile. It's mild, but when I smile, you can see some of my gum tissue. Ideally, you want to see the upper lip right along the upper gum line so that you don't see any gum tissue. But a little bit is okay. And then the lower lip should also fall right along the chewing surfaces of the upper front teeth. So as you can see, when I smile, my lower lip is right along the chewing surfaces of my upper front teeth. That's what we want to see. In some cases, we'll see more of the lower front teeth than we see of the upper front teeth. That may be an indicator that the lower jaw has outgrown the upper jaw. And then the last thing we'll look at is we want to make sure that we see teeth all the way to the corners of the smile. So we don't want to see a lot of space between the teeth and the lips or the corner of the smile. And those are kind of the three foundational things that I look for in a good smile. Regardless of whether the teeth are in perfect position or not, if we can achieve those three things or identify those three things, that puts us in a pretty good position to deliver a good smile once we align the teeth properly. So the next thing that we're going to do, the next images that we'll take a look at are of the patient's bite. We're going to look at how the back teeth fit together as we go from the back of the mouth to the front of the mouth. So as you look at this model, we're going to take a look at the position of the upper and lower first molars. And as you can see, the upper first molar should be about a half a tooth behind the lower first molar. And when it is, and when a patient has a full complement of teeth, the upper canine should be between the lower canine and the lower first bicuspid. All right. So sometimes we'll see a shift. Maybe the upper teeth are shifted forward, okay, and maybe the upper and lower first molars are even with one another, or maybe the upper teeth are shifted back, or the lower teeth are shifted forward, okay? So we're going to look at whether or not we see that pattern, and then we're also going to talk about whether or not that fits into a greater pattern with respect to the patient's jaws. Now, we haven't looked at the x-ray of the patient's jaws yet. We've only looked at the profile, the soft tissue profile. So we're going to try to get an indication of, did we see something in the profile that fits along with what we see in the bite? Next, we're going to look at the bite from the front. we're going to evaluate the vertical relationship between the upper and lower front teeth. The upper front teeth should cover the lower front teeth vertically just a little bit, as you can see here on this model. Okay. And also when we look at the photograph of the teeth from the front, we're going to talk about whether or not the patient has good oral hygiene. Do we see a lot of plaque on the teeth? Do we see excess gum tissue? And various other aspects of the patient's bite as we look at it from the front. Next, we're going to look at each of the patient's dental arches. We use the term arch to refer to the teeth, the gums, and the bone that supports them both. So when we talk about the arches, we're looking at it from this view. You can see why we call it an arch. And we want the arch form to be U-shaped, like you see here on this model. Okay. That goes for both the upper and the lower. We want to see a nice U-shaped arch form. So when we look at these images, we'll talk about the arch form. We'll talk about any deviations from a U-shaped arch form. We'll look at the degree to which there is any spacing or crowding or overlap of the teeth, and anything else we may find when we look at those particular images. Next, we're going to take a look at a couple of X-rays. So the first X-ray we'll take a look at is called a panoramic X-ray. That's an X-ray that shows us all of the teeth and the upper and lower jaws. So when we take this X-ray, there's a beam that goes around the patient's head like this, and then it gives us basically a flat printout of all the teeth sitting next to one another. And when we look at that image, and not just the teeth, it also shows us the jaws and some of the other structures and anatomy of the face and head. So when we look at that image, we're evaluating whether or not there is any pathology. Pathology is a term that we use to describe something that's not supposed to be there, like a growth or an infection. And we're also going to use that image to look at the dental development to determine, have all the teeth come in? Are there any teeth missing? And is there any issue with the eruption of any teeth? Is there something that is blocking a tooth from coming in? The last image I will take a look at is called a lateral cephalogram. The first image that we took a look at and that we talked about was the soft tissue profile to see, does the patient have a good curvature? Okay. The last image that we're going to take a look at, the final X-ray, is going to be an X-ray from the same position. And we're going to use that X-ray so that we can evaluate the position of the upper and lower jaws relative to one another and also relative to the rest of the face. We also use it to evaluate the position and angulation of the upper and lower front teeth. Specifically, we're looking at, are the upper and lower front teeth angled too far forward? Are they too upright? Or are they kind of right in the middle, which is what we want to see. So that's kind of a general idea of what we're going to be looking at. Once we look at those images, then I'll go into a conversation about, I'll summarize all the findings and orthodontic problems, and then we'll go into the part of the conversation where we discuss what the options would be to address all those findings. And, my approach is to offer options that can accomplish the following. The first thing I look at is what would it take to get the patient to the most ideal position, dentally, skeletally, and from a soft tissue perspective. Okay, so that means that I'm going to put everything on the table. Are there surgical approaches that we need to consider? Do teeth need to be removed, etc.? And give you an idea of this is what would be involved if we want to try to get to the most ideal position. From there, we look at, what are our alternatives? Okay, so what you need to understand is that if a surgical procedure is required, if teeth are extracted, if dental extractions are required in order to get to the most ideal result, then that means that if we don't do one of those things or both of those things as an alternative, then that alternative is going to lead to some sort of a compromise. That being said, that doesn't mean that the compromise has to necessarily be detrimental. I'm only going to offer options that are viable. I'm not going to offer you an option that has no relevance. We may talk about some considerations or alternatives that are not really relevant just to give you a full scope of what we can do. But in terms of the options that I'll offer for you or for your child, they will be options that can give us some success, give us a result that improves the situation, not makes it worse. And so we'll go into the details of those options. We'll talk about how long is it going to take. We'll talk about what the risks and benefits of each are. And then we'll talk about, in any case, what it takes to maintain stability of the progress we've made with retainers. And then finally, I will have one of my treatment coordinators go over finances with you. Sometimes we'll do that over the telephone or after the consultation, as opposed to right there in person at the consultation. But that is kind of the final piece of the consultation conversation. So looking forward to describing and going over the findings and describing the options with you. By the time you've reached this point, I've already spent a lot of time working up the case, developing these options. So I am looking forward to going over them in detail with you, and hope that you will be interested and intrigued by what we discuss and what those options may be. Thanks again.